Welcome to the deep dive. Today, we're jumping into something really important, maybe a bit stressful, for anyone around horses. Neonatal foal diarrhea.
Yeah, it's definitely a good one.
We've got your stack of sources, articles, research notes, and our mission is to really boil it down, get you the essential insights on this common but potentially really dangerous condition in young foals.
That's right. It seems common, but you can't underestimate it.
Exactly. You see, the stakes here are just incredibly high. Foals, they're born with these immature immune systems, right?
Right, they haven't built up defenses yet.
And they can get dehydrated incredibly fast. Astonishingly fast.
It can happen in hours, really.
So any foal showing signs of diarrhea, especially if they seem a bit off otherwise, needs a vet looking at them, like pronto.
Prompt evaluation is key. No waiting around.
We're talking about a whole spectrum here. Some cases are mild, they might clear up on their own.
Self-limiting.
But others can get severe really fast. It's often a real race against time. So, okay, where do we start? Let's try and unpack the why. What actually causes diarrhea in these little guys?
Well, our sources generally split it into two main camps: infectious causes and non-infectious causes.
Okay.
And a really critical factor, always, is the foal's age. That helps narrow things down quite a bit.
Right, age is a big clue. So let's start with the non-infectious side.
Okay.
And here's where it gets really interesting, I think. Full heat diarrhea.
Ah, yes, the classic.
This is actually the most common type of non-infectious diarrhea you're likely to see. Usually pops up when the foal is, between 5 and 15 days old?
That's the typical window, yeah. Around the time the mare has her first heat cycle after foaling.
Which is why they call it full heat.
Exactly. But what's really crucial for you to understand here, and what the sources emphasize, is that despite that name, it's not actually caused by changes in the mare's milk.
Oh, interesting. So it's not the milk.
No.
Oh.
It's actually all about the foals on gut maturing. It's a normal developmental stage. Their GI tract is changing, establishing its normal bacteria, that microflora, and they're starting to nibble on solid food, maybe some hay or grass.
Right, exploring the world.
Yeah. And our sources even mention coprophagy, that's eating the mare's manure.
Right. Sounds gross, but...
But it's actually pretty normal, and it helps seed their gut with the right microbes. It's part of that whole process.
Huh. Okay, so that's actually reassuring then.
It usually is.
And the good news is these foals with full heat diarrhea, they're typically bright, they're alert, active.
Bouncing around, still nursing well.
Normal appetite, normal temperature usually. The diarrhea itself might be soft, maybe a bit watery, but often doesn't have that really strong, foul smell you get with infections.
Exactly. And generally, it's self-limiting. It just sort of resolves on its own without needing specific medical treatment.
Okay, that's good to know. But there are other non-infectious causes too, right? Beyond full heat.
Yes, definitely. We should touch on those.
Like nutritional or dietary issues.
Yeah, that can happen. Especially, say, with orphan foals on milk replacer, if it's not mixed quite right, or if they're overfed.
Or even a foal that maybe got separated from the mare and then drank way too much when reunited.
Exactly. Over-engorging. That can cause upset, bloat, maybe some discomfort and diarrhea.
Okay. And what about issues related to birth? Like lack of oxygen?
Right. What they call asphyxia-associated gastroenteropathy. If a foal had a tough birth, didn't get enough oxygen.
The dummy foals.
Sometimes, yeah. That lack of oxygen can damage the gut, leading to diarrhea. Often you'll see it alongside other signs like poor nursing or those neurological signs. Colic, distension, too.
And one more non-infectious one, just eating stuff they shouldn't.
Absolutely. Sand, dirt, shavings.
Yeah.
If they ingest that stuff, it irritates the GI tract.
Makes sense.
Causes irritation, maybe colic, some abdominal distension, and, diarrhea.
Okay, so those are the non-infectious ones. Often less alarming, maybe.
Generally, yes. Though the asphyxia cases can be very serious, of course.
Yeah.
But now, if we shift gears to the infectious causes, this is where things often get much more concerning.
Right, the bugs.
Yeah, and these are potentially life-threatening. What's happening inside is often significant damage right down at the cellular level in the gut lining.
Okay, so actual damage.
Think of it like this. The cells lining the intestine, the enterocytes, they get damaged or destroyed. This completely messes up normal function.
How so?
Well, it leads to this massive loss of water and electrolytes. The gut might start secreting way too much fluid, or it just can't absorb fluids properly anymore.
Right.
Or sometimes motility changes, things just rush through too fast.
Mm-hmm.
Plus, if those cells are damaged, The foal might lose the enzymes needed to digest milk sugar, like lactase.
Ah, so the milk itself causes problems then.
Exactly. Undigested sugar draws water into the gut, causing more osmotic diarrhea. And then if bacteria are involved, their toxins just pour fuel on the fire, causing more inflammation, more damage.
Wow, okay. It really is a domino effect then.
It absolutely can be.
So talking specific infections, viruses are a big category, right? What's the main one?
Rotavirus. That's the big one you hear about.
Right.
Highly contagious, usually hits foals in the first few weeks, maybe up to 2 months old.
And what does it do?
It directly attacks and blunts those tiny little villi, the finger-like projections in the intestine that are crucial for absorbing nutrients.
Ah, so it wipes out the absorption surface?
Pretty much.
Yeah.
And the result is often profuse, very watery, often really foul-smelling diarrhea.
And the foal gets sick quickly.
Oh, yeah. Depression, no appetite, rapid dehydration, often a fever. And it can spread like wildfire on a farm.
That sounds rough. What's the outcome usually?
Well, the good news, relatively speaking, is that if you catch it early and provide really good supportive care, especially fluids, the prognosis is generally excellent. They can recover well.
Okay, that's something. Are there other viruses?
There are. Coronavirus is seen sometimes, less common though. Adenovirus, herpes virus are pretty infrequent causes of diarrhea, usually only in foals that have immune system problems already.
Gotcha. So rotavirus is the main viral player. What about bacteria? You mentioned those can be really bad.
Yes, bacterial infections.
Huh.
This is where things can get very serious very quickly. Particularly concerning are the clostridial bacteria.
Clostridia, like C. diff.
Exactly. Clostridium difficile is one, and Clostridium perfringens type C, it's another really nasty one. We often see these in very young foals, like less than a week old.
And what makes them so bad?
Toxins. They produce really potent toxins that cause severe, often hemorrhagic, meaning bloody damage to the gut lining.
Bloody diarrhea. That sounds awful.
It is. C, perfringens type C especially, can cause this really acute, fulminant, rapidly worsening diarrhea.
Fulminant, like hits hard and fast.
Incredibly fast. Our sources even point out that these foals can get so sick, go into shock so quickly from the toxins, they can actually die before the diarrhea even fully develops.
Wow, that's incredibly sobering.
It really highlights the severity.
Okay, so Clostridia are a major threat. What else on the bacterial front?
Salmonella, another big one.
Highly contagious too, right?
Very. And while it can affect any age, newborns are highly susceptible. Salmonella causes severe enterocolitis inflammation of the whole gut.
What does that look like?
It varies, but often it's profuse, foul-smelling liquid diarrhea, high fever, lethargy, signs of colic, dehydration. And a really big concern is that it can easily lead to septicemia.
The infection getting into the bloodstream.
Exactly. Widespread infection. Because of that risk, the prognosis for salmonella can be quite guarded. It's a tough one.
Okay. What about E. coli? You hear about that a lot with foals.
You do. E. coli is a major cause of sepsis, that bloodstream infection, in young foals. It's actually less common as the primary cause of the diarrhea itself, but it can definitely contribute, especially if the foal is already septic or fighting something else.
Right, sort of a secondary player sometimes.
It can be. And then there's Rhodococcus equi.
Isn't that the one that causes pneumonia?
Primarily, yes. Usually in slightly older foals, maybe 1 to 4 months. But it can also cause intestinal inflammation, enteritis, and diarrhea. Often you'll see it alongside the respiratory signs.
Okay, got it. So viruses, bacteria. What about parasites?
Yep, parasites can play a role too. The main one in young foals is Strongyloides westrator.
Threadworms.
That's them. Foals typically get infected between 2 weeks and 2 months old. And how they get it is interesting. They actually ingest the larvae right from the mare's milk.
From the milk. Wow.
Yeah. And as those larvae migrate through the foal's body and gut, they cause irritation. That can lead to diarrhea, sometimes maybe a fever or colic signs too.
Okay. Any other parasites?
There's Cryptosporidium parvum, or crypto. That's a protozoal parasite.
I've heard of that one.
It's highly contagious, and importantly for you listening, it's zoonotic.
Meaning it can spread to people.
Yes, especially people who might be immunocompromised. So hygiene is extra important if crypto is suspected. Coccidiosis is another possibility, but it's actually pretty rare in these very young foals, more common a bit later.
Okay, so a whole range of infectious agents.
Definitely. And this really brings up a critical point for you to understand. When diarrhea gets severe, it's not just a localized gut issue anymore.
Right, you mentioned septicemia.
Exactly. But even beyond that, our sources stress how it can rapidly become a whole body crisis. That massive fluid loss can lead to hypovolemic shock.
Not enough blood volume.
Right. Which then impacts kidney perfusion blood flow to the kidneys that can start to shut down.
Oh, wow.
And the severe electrolyte imbalances, losing things like potassium and sodium that can even affect the brain, leading to neurological signs like depression, weakness, even seizures.
Is this from diarrhea?
From the severe dehydration and electrolyte chaos it causes, yes. And that risk of bacteria escaping the damaged gut into the bloodstream, causing sepsis, is always lurking.
It sounds incredibly complex and dangerous.
It is, and it's not rare. The sources estimate it affects something like 25% of foals in their first week and maybe 40% of foals between 8 and 31 days old.
Yeah.
It's a really significant issue.
That certainly drives home the urgency. Okay, so faced with all these possibilities, all these risks, if you suspect your foal has diarrhea, how do vets actually figure out what's going on? How do they pinpoint the cause?
Yeah, getting that diagnosis quickly and accurately is absolutely essential, like you said, for getting the right treatment started.
So what's the first step?
Always, always, always starts with a thorough physical examination. The vet needs to assess the foal's overall condition.
What are they looking for specifically?
Well, hydration status is huge. They'll check skin turgor, pinching the skin on the neck to see how fast it snaps back.
That's skin tint.
Exactly. Feeling the gums, are they dry and tacky? Checking capillary refill time, pressing on the gum and seeing how fast the color returns. All clues about hydration.
Okay.
Then vital signs, temperature, heart rate, respiratory rate. Are they normal? Elevated. They'll look at the foal's attitude. Are they bright and alert or dull and depressed?
Yeah.
Are they still trying to nurse?
Nursing vigor, right.
Super important. They'll also gently feel the abdomen for any signs of pain or distension, any swelling, and they'll check the hind end, the perineum, for signs of fecal scalding or irritation from the diarrhea.
Okay, so a really thorough hands-on check. What about the history, what you tell the vet?
Critically important, a detailed history provides so many clues.
Like what sort of things?
The foal's exact age, first of all. When did the diarrhea start? How long has it been going on? What does it actually look like? Is it watery, pasty, bloody? Does it have a particular smell?
The character of the diarrhea.
Exactly. Also, information about the mare, her health, her vaccination history, the farm environment, are other foals sick?
That points towards infectious causes.
Right. And crucially, did the foal get enough colostrum, that first milk? Was an IgG test done to check their antibody levels?
Passive transfer status.
Yes. Knowing if they have failure of passive transfer, FPT, is vital. And things like recent deworming history, all these pieces help build the puzzle.
Okay, so physical exam, good history,
Yeah.
then you need samples, right? Fecal samples.
Absolutely. Fecal analysis is key, especially for figuring out the specific cause.
What do they do with it?
Well, first, just a gross examination, looking at the consistency, color, presence of blood. That gives initial clues. Then, microscopic analysis.
Looking for parasites.
Yeah. Things like a fecal flotation can pick up eggs from parasites like strongyloids, or direct smears might show things like giardia or cryptosporidium.
But what about the bacteria and viruses?
Right. For those infectious agents, PCR panels are often the preferred method now.
PCR, like DNA testing.
Essentially, yeah.
Yeah.
They look for the genetic material, the DNA or RNA of multiple pathogens all at once from a single sample.
Oh, that's efficient.
Very. It's highly sensitive, usually quite rapid. It can detect rotavirus, coronavirus, clostridial toxins, salmonella, E. coli, even R. equi sometimes, all in one go.
Wow.
There are also other tests, like ELISA tests, which look for specific antigens like rotavirus antigen or clostridial toxins. Those can be quick too.
Okay. What about growing the bacteria?
Yeah.
Culture.
Bacterial culture and sensitivity testing is still really important, even if it takes a bit longer, usually a day or two.
Why is that?
Because it doesn't just tell you if bacteria like salmonella or clostridia are there.
Yeah.
It tells you which specific strains might be involved. And crucially, it tells you which antibiotics will actually work against them.
Ah, the sensitivity part. So you're not just guessing with antibiotics.
Exactly. It guides treatment much more effectively, especially for those serious bacterial infections.
Okay, so fecal tests give us clues about the gut. But what about the foal's overall health? How does all this diarrhea affect the rest of their body?
That's where blood work comes in. It gives us that bigger picture.
What kind of blood tests?
Usually a complete blood count, a
Yeah.
CBC, that looks at white blood cells, are they high, suggesting infection or inflammation, or sometimes dangerously low in severe sepsis. It also checks red blood cells for anemia and helps assess hydration status through things like packed cell volume. Then a chemistry panel. This is huge for looking at electrolytes, sodium, potassium, chloride, which get thrown way off balance with diarrhea. It also checks kidney function markers, like creatinine and BUN, which can elevate if the foal is dehydrated and the kidneys are stressed, and protein levels, which are important for immunity and fluid balance.
And you mentioned the IgG test before.
Yes, absolutely critical in a newborn foal with diarrhea. IgG testing tells us about their passive transfer status. Did they get enough antibodies from mom's colostrum?
And if they didn't, FPT.
Failure of passive transfer, yeah. Foals with FPT are hugely susceptible to severe infections. Knowing their IgG level is essential for deciding if they need things like plasma transfusions.
Right. Makes sense. Are there other diagnostic tools, like imaging?
Sometimes, yes. Abdominal ultrasonography can be really useful.
What can you see with ultrasound?
The vet can look at the intestinal walls. Are they thickened, suggesting inflammation? How is the gut moving? Is motility normal or abnormal? Is there excess fluid accumulating in the intestines or the abdomen? It gives a real-time view of what's happening inside.
Okay. What about x-rays?
Abdominal radiography or x-rays are done less often for diarrhea itself, but they could be helpful if the vet suspects the foal might have ingested sand or some other foreign material that could be causing irritation or blockage.
And I think sometimes they pass a tube.
A nasogastric tube, yeah. That's often done if the foal is also showing signs of colic, along with the diarrhea, to check for a reflux fluid backing up into the stomach, which can indicate a more serious issue like an obstruction or ileus, where the gut stops moving.
Okay, quite a comprehensive workup then.
It often needs to be to get the full picture quickly.
So once the vet has a diagnosis, or at least a strong suspicion of the cause, what happens next? How do you treat this? You mentioned it varies a lot.
It really does depend on the cause, and just as importantly, how severely ill the foal is. For the really sick ones, hospitalization and intensive care are often required.
Right, they need round-the-clock support.
Absolutely. But regardless of the specific cause, the absolute cornerstone of treatment is supportive care.
Supporting the foal's body while it fights.
Exactly. You have to manage the consequences of the diarrhea while addressing the underlying cause, if possible.
So what does supportive care involve? Fluids must be top of the list.
Number one, absolutely. Fluid and electrolyte replacement. For moderately to severely dehydrated or systemically ill foals, that means intravenous or IV fluids.
Like lactated ringers solution.
Often lactated ringers, yes, or similar balanced electrolyte solutions. Sometimes they need extra electrolytes like potassium or bicarbonate, added depending on the blood work. For milder cases, if the foal is still nursing and bright, oral electrolytes might be enough.
Okay. What about nutrition if they're not nursing well?
That's critical too. Nutritional support. Ideally, you want them to keep nursing from the mare if they can. That milk is the best thing for them.
But if they won't or can't?
If they're anorexic or too weak or septic, then other options are needed. Sometimes partial or total parenteral nutrition, which is IV feeding, providing nutrients directly into the bloodstream.
Wow, okay.
Or careful, small volume, feeding through that nasogastric tube enteral feeding. That can help provide calories and also stimulate the gut to keep working.
Right, keep the gut moving.
Yeah. Then there are GI protectants and absorbents, things that can help soothe the gut lining or bind up toxins.
Like what?
Products containing bismuth subsalicylate, like Pepto-Bismol, can have some coating and anti-inflammatory effects. Activated charcoal might be used if toxin ingestion is suspected.
To bind the toxin.
Right. And products like ditrioctahedral smectite, Biosponge is a common brand, are clay-based adsorbents thought to bind bacterial toxins, particularly clostridial toxins.
Okay. What about probiotics?
Probiotics are available, yeah. Their effectiveness is still debated. I mean, the evidence isn't super strong yet. And vets are usually cautious about using them in severely immunocompromised foals, like those with FPT or sepsis, just in case.
Gotcha. And ulcers, are they a risk?
Definitely. Sick, stressed foals are very prone to gastric ulcers. So gastric ulcer prophylaxis, usually with Embrazole, is a common part of the treatment plan.
Makes sense. One more thing on supportive care, the foal's back end.
Oh, absolutely crucial. Perineal care. Diarrhea is incredibly irritating to the skin.
Fecal scalding.
Exactly. You have to keep the foal's hindquarters meticulously clean and dry, wash gently, dry thoroughly, and apply a protective barrier ointment like Desitin or zinc oxide.
That's the foundation: fluids, nutrition, gut support, keeping them clean. What about specific treatments based on the diagnosis?
Right. This is where it gets tailored.
Let's circle back to full heat diarrhea first. What's the specific treatment for that?
Well, this is the key thing our sources emphasize.
Mm.
For typical fall heat diarrhea, usually no specific medical treatment is needed at all.
Really?
Yeah, beyond that basic supportive care we just talked about, mainly keeping them clean, making sure they stay hydrated by nursing, anti-diarrheal medications are generally not recommended and might even be harmful by slowing gut motility when the body is trying to clear things out.
Okay, so mostly monitoring for that one, but what about the infectious types?
That's different. For suspected bacterial infections, or if the foal shows signs of sepsis, antibiotics are usually started right away.
Which ones?
Often a broad-spectrum combination, like penicillin, plus an aminoglycoside like gentamicin or amikacin, or perhaps a third-generation cephalosporin, something to cover a wide range of likely bacteria.
And if you suspect Clostridia,
Metronidazole is often added to the mix if Clostridium species are high on the suspicion list, because it's effective against those anaerobic bacteria.
and then you adjust based on culture results.
Exactly. Once the culture and sensitivity results come back, the vet can switch to the most targeted and effective antibiotic for the specific bug, like for Salmonella or resistant Clostridia.
Okay. What about viruses like rotavirus? Any specific drugs?
Unfortunately, there aren't any highly effective specific antiviral drugs for the common equine diarrheal viruses like Rota. So, treatment remains focused on intensive supportive care fluids, electrolytes, nutrition, while the foal's immune system fights off the virus.
Got it. And parasites, like the threadworms.
For Strongyloides westeri, yes, there's specific treatment. Deworming with an appropriate anthelmintic, like ivermectin or fenbendazole, is effective. Deworming the mare around foaling time can also help reduce the transmission through the milk.
Good tip. What else might be used in treatment? Inflammation control?
Yeah, anti-inflammatories, usually NSAIDs like flunixin, biglumin, banamine, are often used carefully to reduce fever, pain, and inflammation associated with enteritis. And sometimes anti-endotoxemic agents are used.
To fight toxins.
Specifically endotoxin, which is released from certain bacteria like Salmonella when they die and contributes to shock. Agents like polymyxin B or that biosponge product can help bind endotoxin.
And you mentioned plasma transfusions earlier.
Yes, plasma transfusion is really important for foals with documented failure of passive transfer, FPT, to give them those essential antibodies they didn't get from colostrum.
Or if they're very low on protein.
Exactly. Severe hypoproteinemia is another reason. Sometimes hyperimmune plasma is used. That's plasma collected from horses specifically vaccinated against common pathogens like rotavirus or salmonella, providing targeted antibodies.
Okay, so a lot of tools in the toolbox, depending on the situation.
Definitely. And alongside treating the individual foal, environmental management and biosecurity are absolutely critical, especially on a farm.
Preventing spread.
Exactly. If we connect this to the bigger picture, controlling spread is vital. First step, immediate isolation of any affected foal, especially crucial for highly contagious things like rota or salmonella.
Keep them away from healthy foals.
Absolutely. And then rigorous hygiene, thorough cleaning and disinfection of stalls, buckets, feeders, anything the sick foal touched. And strict hand hygiene for everyone handling the foals, washing hands, changing clothes, using foot baths between stalls.
Non-negotiable stuff.
Totally. And maybe the most important preventive measure overall is ensuring good colostrum management for all newborn foals.
Making sure they get that first milk.
Yes. Every foal needs adequate amounts of high-quality colostrum, ideally within the first 6-12 hours of life, to absorb those vital maternal antibodies for passive immunity. Testing IgG levels around 24 hours old confirms if they were successful.
And vaccination.
Yes, mares can be vaccinated against rotavirus in late pregnancy. This boosts the antibody levels in their colostrum, giving their foals extra protection right from the start.
Lots to consider for prevention, too.
Prevention is always better than cure, especially with something this serious.
Well, as we wrap up this deep dive, it's just abundantly clear that neonatal foal diarrhea is it's a really dynamic and serious condition. It needs respect.
Absolutely. It can change so quickly.
And close monitoring, quick vet intervention, and that aggressive supportive care you outlined are just absolutely essential for improving the outcome, especially, like you said, with those infectious causes that can move so fast.
Yeah. And what's really fascinating and sometimes heartbreaking is how much the prognosis can vary. It's often excellent for a foal that gets good care for rotavirus, but it can be much more guarded, even poor, for severe salmonella or Clostridium infections, or for any foal that develops complications like sepsis. Things like severe hypothermia, being really cold, those are often bad signs.
So many factors.
It really comes down to that interplay. The foal's own immune status, which specific bug they're fighting, and crucially, how fast effective treatment is started. It truly dictates the outcome.
Which really leads to a final thought, something for you, the listener, to maybe mull over. Considering how quickly a foal's condition can plummet and how absolutely vital good immunity is right from the start, what could be the broader implications here? If we really understand neonatal health in vulnerable populations, animal or human, what could that teach us about developing better proactive monitoring, better rapid response systems? Are there lessons from the equine world from dealing with these fragile foals that might apply far beyond the barn?